From the protection of personal information to a former AHS president's concerns over health privatization and the impact of Stephen Gibo's departure from the Carney cabinet. Time now for tonight's politics panel. And joining us this evening, Najib Jutt, a political advisor and brand strategist who's worked on election campaigns at every level of government here and abroad, and John Brennan, political analyst and commentator. Good evening to you both, and let's begin on the conversation we heard before the break. Information and Privacy Commissioner Diane McLeod on her concerns over plans to add healthcare numbers to driver's licenses and other forms of ID. Najib, surprised the government would press forward regardless of the risks identified. What does this dialogue around policy change reflect to you?
Yeah, I mean, it's very confusing. I mean, other than their argument for red tape reduction and having everything on one card, it doesn't make a lot of sense. I mean, to the privacy commissioner's comments, it's just, you can also, I mean, why haven't we had a plastic card with a picture on it for healthcare in all of this time when other provinces have it and have had it for a long time? I mean, that would be the easiest solution for anyone who doesn't want to have a digital ID, is just have a proper healthcare card with a picture on it. And the other solution for everyone else is a digital ID, right? It's something that you don't have to carry around and show, and you just have it. And then you have the additional protections of digital ID as well, which is, thumbprint or facial recognition and all the other stuff that we have on our phone to protect our credit cards and our bank accounts. It just seems like there's easier solutions that are out there, and this doesn't really solve anything.
John, Minister Lagrange's office has stated Diane McLeod's recommendations are being reviewed. Further regulations will be developed after the bill is passed in the legislature. What's to be made of that approach to implementation?
Well, they should have done that before they introduced the bill, Michael. It's clear that they didn't consult with the privacy commissioner before they came up with this plan. And now that they've come up with it, the privacy commissioner has pointed out all these problems with it. Minister Lagrange has never really explained why it's necessary to put people's public health care numbers on driver's licenses and other ID cards. They've never really given a proper explanation for it. And as Najib just said, the smartest thing to do would just be to renew everybody's Alberta healthcare cards with a picture on it, the address, and the public healthcare number. And then everybody has their proper ID for healthcare, and you have your proper ID for other things that you use your driver's license for. There's no need to put public health numbers on driver's licenses, and the government has not explained why it's doing it. And they certainly should have consulted with the privacy commissioner before they came up with this plan in the first place.
The privacy commissioner definitely laying out some risks that involved in going this route. We'll have to see what happens moving forward. Now, for us to move forward, next up, a former AHS CEO weighing in on the Alberta government's decision to delve further into private health care.
In a sense, the hospital system ends up as a two-speed system. That is, if you've got hip pain or knee pain and you need to have a hip replacement or a knee replacement, the waiting time for that is much shorter in the private if you go privately than if you go on the public hospital system.
Yeah, Stephen Duckett, an internationally respected healthcare economist who was president and CEO of HS 15 years ago. He says Alberta should proceed with caution. He's now a health professor in Australia, where about half the population uses the private system. Stephen Duckett, he features in the first part of a CTV Edmonton series on challenges facing healthcare in Alberta. And John, Duckett's time here in Alberta, the role he played in cutting health spending and overseeing the amalgamation of health regions was a controversial one. To what degree does that era 15 years ago reflect the current state of healthcare in the province? And should the government be taking note of the advice he's offering?
I'm not sure if they're going to take note of the advice he's offering, Michael. His tenure as the CEO of Alberta Health Services was certainly very controversial and contentious. But he does make a good point in his interview with CTV Edmonton there, where he says that people who have the financial means, people who have the money, if they need to have a knee replacement, a hip replacement, or some other orthopedic surgery, they are likely going to gravitate to the private system to get that done sooner rather than wait to get that done in the public healthcare system for free. And so, the last time we spoke about this, Michael, it is clear that the UCP government is looking at setting up a two-tiered healthcare system here where people who have the financial means will be able to get procedures done sooner, and people who don't have the financial means will have to wait to get the surgery done in the public healthcare system.
Najib, Stephen Duckett says in that CTV Edmonton piece that ran last night, he says, were he still living in Alberta, he'd consider legislation allowing some doctors working in both private and public systems a scary policy initiative. What do you make of hearing an Australian's perspective on this?
Well, there's two things, Michael, to know. First of all, the best way to alleviate pressure on a public healthcare system is to have it well-funded, to have higher wages for healthcare workers and doctors, and also better working conditions. That's the best way to alleviate, any type of pressure on a public healthcare system, which isn't what this government is doing. The second thing, which it's always important to know what governments leave out. The Australian healthcare system has a carrot and stick incentivization program to get people to participate in their private healthcare system. The carrot is there's subsidies provided to low and middle income people. So they pay up to 25% of your healthcare, your private healthcare premium, for you to use the private healthcare system. And there's actually a tax punishment for higher income people, right? So if you don't use if you have the income and the means to do it, and you don't use the private healthcare system, then your tax is higher. You pay a higher tax. Right, so they leave out these kinds of little incentives, right? I mean, absolutely, a private healthcare system would work, if you're subsidized to use it. If the government subsidizes, then it makes it more affordable for you to use.
John, do you see reason for Alberta to take a look at what's happening in Australia?
Well, when they brought in this proposal, Michael, they made a great deal of talking about how there are variations of this in all the liberal democracies around the world, in Western Europe, Japan, they cited Australia. And so there is a mix of public-private in all the healthcare systems in all the other democracies. The problem is here in Canada, under the Canada Health Act, for medically necessary procedures, you're not allowed to bill for them. That contravenes the Canada Health Act. And what I'm really going to be interested to see, Michael, is once this legislation is passed, and I presume it's going to pass in the next week or so, and once the ministerial orders are put in place and the regulations are set, I'll be really interested to see if this legislation is challenged, either by the federal Liberal government or by some public health care advocates in Alberta, say like the Friends of Medicare or Public Interest Alberta. Because I think this legislation is going to be challenged, Michael, because I don't see how allowing doctors to charge for medically necessary procedures isn't a contravention of the Canada Health Act.
All right. Time for us to take a bit of a break. But when we come back, getting a read on fallout from Stephen Gibo's cabinet departure. More from our politics panel in a moment. Welcome back. Canada's former environment minister may still be in caucus, but Stephen Gibo is sounding off on the government's agreement with Alberta that could lead to a pipeline.
We can't, as a government, say that the involvement of Indigenous peoples is a priority and not consult them on things like this memorandum of understanding, not even reach out to them before the MOU was announced.
Stephen Gibo resigned from cabinet last week on principle, but agreed to stay on in the Liberal caucus. He told reporters Wednesday he has real problems with the energy deal Ottawa signed with Alberta. Najib, how is it that Gibo can stay in government? Would it not have sent more of a message to just outright quit as an MP?
No, you know what? I think he's commented, and rightfully so, that by staying in government and being on the environmental committee, he can be more of a thorn in the side as this progresses, and be able to criticize openly as he couldn't as a minister. I think we should all give him credit, right? We need more politicians who have values, who stick by their by some sort of a red line on their ethics, right? And he's done that. He's had to compromise in the past. and he's done that as well. He knows how to play the political game, but this was something he couldn't compromise on. And I think we need more politicians who are able to do that and who do have a ability to draw a line in the sand as far as their values and ethics go.
John, how much political damage do you think Stephen Gibo has done to the Carney government by quitting cabinet?
None. And that's clear, Michael, from the 2 polls that have been released since the memorandum of understanding was signed between Mark Carney and Danielle Smith last Thursday. You recall last Friday, we got the poll from Angus Reid showing 60% of Canadians supported the MOU, only 25% opposed. Yesterday, we had the Abacus data poll out showing 66% of Canadians supported, only 19% opposed. Here in Alberta, 74% of Albertans support the MOU. Even in Quebec, more people support it than oppose it. My favorite part of the Abacus data poll yesterday, Michael, showed that Mark Carney had a 48% approval rating in Quebec, and Stephen Gibo is only his approval rating was 25%. I think a lot of political commentators and analysts have overstated the impact Gibo's resignation had, and I think Stephen Gibo is overinflating his own sense of importance, because at the end of the day, Canadians are supportive of Mark Carney and what he's trying to do, and what he is trying to do is build the Canadian economy, make us more resilient in the face of the threats from Donald Trump, and to diversify our export markets. People are not listening to Stephen Gibo anymore or to Elizabeth May. They want to build this country, and that's why Mark Carney has the support of Canadians at this moment.
Najib, to what degree does Gibo quitting cabinet change the relationship dynamic between Alberta and Ottawa? Albertans know well how the Smith government feels about the former environment minister.
Well, to John's point, I don't think it changes much other than doing what he said he's going to do, which is being able to openly criticize a little bit more. I think the more thing about the polling, I think, is that I think people are living in the past. We've had 2 years of surpluses based on oil royalties in this province, and I continually ask people to ask themselves why it doesn't feel like we're in economic booms, and the reason why it doesn't is more and more these oil companies, who are majority foreign-owned, do not reinvest in Alberta. They do not increase workers' wages. They do not create more jobs. All they do is do shareholder buybacks and use the profits for their own use. And pumping more oil isn't going to change anything if that's the condition. If we don't increase our royalties, and collect more revenue from our oil that we can put back into the economy, all we're doing is making these foreign-owned companies richer, and that's all it will do. And actually, you have to ask yourself if that isn't actually the objective, is to generate more income for these foreign-owned oil companies that operate in this province.
John, taking into consideration Gibo's cabinet departure and the pipeline MOU with Alberta, where do you think that leaves federal climate change policy?
It's in abeyance right now, Michael. The polling, and it's crystal clear in the Abacus data poll yesterday, Canadians' concerns are with the economy, jobs, inflation, affordability, cost of living. They're behind what the federal government is trying to do, and that is with its major projects, build the Canadian economy, make it stronger. That will make us more resilient in the face of the threats we're facing from Donald Trump, both to our economy and our sovereignty, and to diversify our export markets. So we need to do all those things. I think the big test, Michael, is going to be in the new year, in 2026, because Mark Carney has now set the table. We have the budget approved in principle, although the legislation still has to be approved. He's set up the major projects office in Calgary. We've got a number of major projects that have been referred to that office for approval. We have got to get going on getting these projects going. And that's how Mark Carney and his agenda are going to be judged, getting these projects going so that we see the effects in the economy.
Najib, last 30 seconds to you. How worried should the PM be about support within his own BC caucus?
Well, I think there is going to be obstacles to overcome there, which we saw in the Trans Mountain discussions as well. I think there's also Indigenous rights that we need to, that are going to be concerns as well. But I think overall, I'm all for diversification. I'm all for finding other customers for not just oil, but our other resources. But I think we need to look closely at whether that's going to be what happens. I mean, as we've seen with Trans Mountain, it's just more crude being put on ships and shipped down to the U.S. to refine and send back to us, right? So I think, there's also has to be a look in terms of whether that's what we need to continually be doing, is pumping more crude and giving it to other nations to refine and sell back to us and sell to other countries, where actually, the jobs and the economic opportunity may lay in the refining of the oil, and also looking at other natural resources, not just oil.
All right, gentlemen, we're clear out of time. Have to leave it there. Great to see you both. Thank you.
Thanks, Michael.
Thanks, Michael.